Tuscaloosa, Alabama. I'm a general ophthalmologist. Ophthalmology provides office-based practice where you get to do some neat surgery and really gratifying because patients get better when you do surgery on them. Used to do a lot of our surgery at the hospital, and then we eventually came up with our own surgery center.
I worked for many years in the operating room with another company, and I had previously worked with all the owners here. And when time came to open up their own surgery center, they called me and asked me if I'd like to run it. It's much more efficient. You can do probably twice as much surgery here as at any of the other facilities in town. Plus, we get to hire the people that we want, hire only the best people, and we have a lot more control. We are the only facility dedicated strictly to the care of the eye. That's all we do is eye surgery. You can't get that in this city any other place. Certain expertise that comes of doing the same thing all the time, and we get really good at it.
Our practice is unique in that we try to be both a primary care and referral-based practice. While we have our own patients, we also work closely with optometrists to care for the surgical needs of their patients as well. And the fact that we can come to the Vision Correction Center, our own ASC, we can do a lot of same-day surgery.
When we see technology that we think is efficient, we don't have to go through some governing board and try to get it approved and wait a long time. Basically, if the owners decide that we want to get something, we get it. Trabectome filled a niche. You had your patients, you had drops, you had SLT lasers, and then if they weren't really controlled with that, then the next step is to send them an hour away to the glaucoma specialist for trabeculectomy, which is a lot bigger procedure with a lot more side effects, and so that was the main, sort of we're looking for a procedure to fill the gap in between what you can do in the office with the drops and SLT and going, trying to hit the home run with the trabeculectomy. So Trabectome seemed to fill that niche pretty nicely. If you really need a procedure and need equipment or a lens or whatnot, you always try to put the patient first. The doctor needs this to take good care of his patients. Anytime you start out with a new procedure, I did 4 this morning, you always have a little anticipation and so forth, but it went surprisingly well, better than I had probably anticipated. The training course in California that I went with, was well done, and I was prepared. I knew what to expect. Having done a bunch of cataracts in the past and being familiar with intraocular surgery, it's just a matter of your hands are in a different position than you're used to with cataract surgery, and the microscope's a little different. So it's just getting around some of the, learning some new techniques, basically.
It was really great. I've seen other similar methods of treating glaucoma, and this is by far the simplest I've seen.
So I did the Trabectome for the first time yesterday, and the case went great. I was shocked how easy it was. The patient looked great today on day 1.
Tomorrow, okay? Yeah. Everything went perfect, just like we wanted to, okay? Okay. Great. I'll see you tomorrow, okay?
Well, I looked great. She was reading a book when I came in. She said she had a little light sensitivity, but that's it. Certainly wouldn't have guessed that she just had intraocular surgery.
It's good to hear it, yeah. It's pretty much textbooks. Yeah, that was big. Yeah, you're off to a great start.
So, that was great. That was very easy. Shockingly easy.
Oh, that was about as good as the first case can be. Dr. Johnson was very confident and used the Trabectome in a very good way in his first surgery. The view was very good. The ablation looked just perfect, and so pretty much textbook, and glad to see things went so well.